just showing up, right? Showing up to the table and showing up at the meeting to say, let's lay it all out there and let's do what's best for the resident.
Welcome to the Contributor Wednesday series on the Bridge the Gap Network. This series is sponsored by Peak Senior Living by Functional Pathways. Each week, you'll hear from a thought leader discussing topics that are relevant and impactful to the senior living industry.
Welcome to Bridge the Gap, the Senior Living Podcast with Josh and Lucas. On a Contributor Wednesday special edition, we want to welcome a good friend and one of our key sponsors here for Contributor Wednesday. I want to welcome Kathryn Wyatt. You're the Divisional Vice President of Peak Senior Living by Functional Pathways. Welcome to the show.
Thank you so much. It's so good to see y'all and spend some time with you again.
Exactly. Last time we were all together, I believe we were in, I think it's your hometown, Nashville, correct?
Yeah, correct. Yeah, such a great conference. I really enjoyed that. Such a great time to get together. And now that everything's opening up, everybody was buzzing around. So it was a great few days.
No doubt. Nashville's a lot of fun, and it's always great to have conversations with you, Kathryn. And today on Contributor Wednesday, one of the great things about our Wednesday weekly shows is that it offers an opportunity for a diverse audience and diverse topics, diverse hosts to come on and give their point of views around different topics related to the senior living industry. And you guys are certainly very passionate about this industry. For our audience that has been seeing like, oh yeah, Functional Pathways, Peak Senior Living, like I've been seeing that they sponsor this great content, give them your kind of just a basic overview of what you guys provide to the senior living industry.
Sure. So, we've been in the senior living industry for quite some time now. And so we provide traditional outpatient PT, OT, speech therapy in assisted living, independent living communities, life plan communities. But, we also have a wellness division where we really focus on those dimensions of wellness and, uniquely offer some activities, some elevated activities. And, the core of what we do is really following that resident through the continuum of care because sometimes landscapes are changing and we're seeing some acuity increase and a lot of active individuals out there. And so we want to walk with them on their journey and make sure that we are there every step of the way. So that's and partnering with incredible people and communities out there that we're all focused on the resident.
That is exciting and so important. Our mission here at Bridge the Gap is to educate, inform, and influence. And you guys obviously value that as well and helping bring this type of content to our audience. So as we dive into some of these important issues around the well-being, this kind of wellness movement that's happening with older adults, what role do fitness tests play in evaluating the needs of a resident population, and how are those used to start short-term, and how are you using those short-term and long-term?
Yeah, so the fitness test, back in the day when I was trying to be a great runner and a marathoner and going through fitness tests and they're, trying to decide what kind of minute mile I can run. I'm not sure I want to be tested on that. However, these senior fit tests that we provide and conduct in our communities, they are a tool for our residents. They're a great way to look at a lot of different areas. And what I love about the test is that there's immediate feedback for the residents, and it's an easy way to see it. There's reporting that comes out of that. There's bar graphs to show them. It's a really like a total assessment, whole body assessment. And it shows these areas that we may not even pick up on. They may not even see that they're struggling in an area or maybe getting from their apartment to the dining room. But it allows us to see those little bitty, minuscule declines that if we can jump in and help them and talk to them, it's all about education. Let's tell them where they're at, and then they can decide, they're their best advocate. And what are their goals? Do they want to feel better and they want to pop out of bed a little bit easier and get down to the dining room to hang out with their friends? And so we can intervene. And maybe at that point it is therapy. Maybe it's some PT, or maybe it's a wellness class. Maybe it's not, oh, you really don't need us right now. You could probably go to this wellness class, or what about the aqua flow class that they have, the water aerobics. And that's a great way to, focus on these areas. And over time, when we do that a couple times a year or year over year, we can see how they are functioning in their community. Though that's really the short term way that we use those, but long term, we are able to provide our partners with how we're doing on campus, how engaged our residents are, how are they functioning last year, and then how are they functioning this year. And that may really spark a great conversation to say, why don't we renovate this area over here and make this a more common space, and they can come and hang out, and we can create more movement and more socialization to get them out of their room and walking more. And so it's yes, it's a individual test, but it speaks volumes to how we can walk through that journey with the residents in that continuum of care. So they're really fun. It's interesting because there are some residents who they demand therapy because they see a little bitty area that they may be declining in, and they're fearful. They're fearful of, I don't want to let that go because I really don't want to be in my room more than I have to be. And I don't want to lose that skill. So that's where that education piece comes in, and just making them aware. And often they will opt for the more the more intense therapy to get back on track. So
well,
it's pretty cool to see.
Kathryn, you talked about a couple of different things there with the tests and the education, and how you guys are part of that. So break that down a little bit practically, the partnership with the community. And, I'm assuming communities are all different, teams are all different, but how do you guys integrate with a local team and a local community to kind of ensure there's this continuity of care and communication? Can you kind of break that down for us?
Yes, absolutely. I'm so glad you asked that. Because this is one area that I am very passionate about in leading this division. Is first things first. Our residents are there, and they need all of us, and they need all of our attention. They need our attention, the facility's attention. And then next steps are, when we engage with partners and we develop this relationship, we are very specific on, what does our program need to look like? What do you all need from us, and what do we need from you all, and how does that look? Like you said, a lot of facilities are unique, and they have values and they have specific focuses in their facility. We want to make sure that we deliver and that we are a partner. And so we develop a program with our partners for that campus, for those residents, for the activity level that they're at, and the opportunities that are there on campus. And so it's really unique, and we can customize that. That is what, functional pathways, Peak Senior Living, we are very focused on customizing our programming for the residents in the facility. So we start our relationship there. It's, what are our expectations? And let's just put them all on the table. Let's identify where we're going to start. And then every quarter we talk about it. And there's, like I said, that senior fit test data, outcomes data, client survey data, meaning our residents survey expectations and results. And we just say, hey, this is working, this is not working. What do we want it to look like for the next quarter and the next year? And that's been really rewarding as a partner, because we are an asset. We want to be a family, and we want to be connected and working together in synchrony. So, and it's a lot of just showing up, right? Showing up to the table and showing up at the meeting to say, let's lay it all out there, and let's do what's best for the resident. And we know the facilities, that's their vision, that's our vision. And so that's been rewarding to see how our programs have developed in our communities to meet that.
Well, I'm sure some of our listeners, because it's a very broad group, all different types of communities across the country. I'm sure some of this has definitely sparked attention, and I'm certain there's some out there that maybe haven't had a formal, actual wellness program in place or a partner to help them manage and implement a wellness program per se. Maybe they're just partnered with, home health or something coming in for the different therapies. But for the provider out there that's thinking, man, I would really like to implement a program like this, what are some of the first steps in even planning? Are they immediately ruled out if they don't have a large wellness gym or a pool or aquatic center? Or are there certain things they need to have in place before they would even contact someone like you?
The only thing they need in place is passion for the resident. We can do anything. Again, it's not about seeing what we can't do. It's about seeing what can we do, and there's always a way. Some facilities don't have the aquatic center that you're talking about or a gym for us to be in, but everybody has a resident, and residents need help and they want help. And so that's again where we come in and say, what is it that you have at your community? And let's figure out how to make this work. You're right. They may only have home health. They may not have something in place now, but that's where our expertise comes in. We have many, many years of experience. We have a lot of resources. We've got a robust clinical team, and we've got specific programs that we can implement, and we can develop new programs. I mean, the sky is the limit. We also partner with home health. So yes, we offer PTOT speech, but we can also partner with home health and use those same therapists in that facility, so the residents are comfortable. They get used to those therapists and they learn them and they become part of the family. And the residents' grandkids come and they come down to the gym, or they see us in the hallway. And so that consistency is really key, and that's really important. We can bring in wellness and therapy. We can just provide therapy. We've got activities as well. So ultimately, it's not about what the facility has or doesn't have. It's what do we want to do for the residents and how do we make that happen? And I'm really proud to be part of a company that we can customize that, and we work together, and we've got that personal touch. So many facilities look different. And so I never want somebody to think, oh gosh, we don't have that. We're not state of the art. We've got an old building, because that's out there. We have a lot, there are a lot of old buildings, and man, that Wi-Fi, that's hard to go through those concrete blocks, but we make it work somehow. And it's incredible to see the residents light up and really work with them and get to know them.
Well, Kathryn, it's awesome to have Peak as a partner, just providing so much education through our contributor program on Wednesdays. We have a powerhouse group, and through your kind and generous contribution to the industry, you're not only helping to improve longevity for our residents and overall wellness, but you're powering education for all of our listeners. So me and Lucas are so appreciative of the investment you've made into the industry, and what an awesome opportunity it is to be able to provide that to the industry.
Yeah, it's again, we appreciate everything you guys do to create the platform. I mean, to create the opportunity to have voices out there. And as this industry is evolving and as we keep revolving around the sun, it's we need everybody, and it takes all of us. It takes all of us to reach residents and to provide the care and give back. I mean, I just keep thinking, my goodness, so many people have gone before me and us. And so, what a great way to continue, serving others. And so, no, we appreciate being partnered with you guys. And thank you for allowing us to do that.
Lucas, the last thought I have is on these fit tests. I'm feeling like we're kind of getting through these holiday seasons. You might want to line up for one of these fit tests and benchmark yourself for longevity, right?
Yeah.
I already know the answer. There's no need.
That's what I was talking about earlier. Sometimes I don't know I don't want to know those results. And like I said, the residents are, when we have that cognitive component in there, that's where they really tap in, and they are like, I can't lose my memory. I can't do that. So you gotta come in and help me. So it's great. It's really good. It's good to provide that education. So.
Well, we appreciate the passion. We appreciate the support here on the Contributor Wednesday program, and to all of our listeners that get to enjoy this content. If you want to see more content and more shows, go to bggvoice.com and you can download our information there. Also connect with us on social, be a part of the conversation. Kathryn, thank you so much for spending time with us today.
Absolutely. So great to see you all. Thank you.
And thanks to all of our listeners for listening to another great episode of Bridge the Gap.
Thanks for listening to the Contributor Wednesday series on the Bridge the Gap Network, sponsored by Peak Senior Living by Functional Pathways. For a full library of episodes, visit btgvoice.com.